When we talk about microdosing GLP-1s, we're really talking about people taking a lower than standard dose of GLP-1 medications. So when you get GLP-1 medications from your doctor, you get a prescription, you take it to the pharmacy. It often comes in pens, and there are preset doses. And there are doses that we as doctors prescribe you to take based on what the FDA approval is. And these doses have been determined by studies, lots of studies and lots of data to determine what doses there should be. By the way, there are also vials of these medications that sometimes the companies sell themselves, but still there are preset doses. When we talk about microdosing GLP-1s, we're talking about taking lower doses than those sort of preset FDA approved doses that we already have established. And what I have been seeing is there's a lot of companies popping up online, etc., that are offering microdosing GLP-1s. Oftentimes they're doing this by offering compounded forms of GLP-1s. I have a whole video on compounded versions of these medications, and there's a lot of potential sticky points with compounded medications. They're not necessarily bad, don't get me wrong, but there can be problems. They are not exactly the same. There can be differences that really make them less than ideal. I'm going to leave that for the other videos I have on them. But just understand that compounded medications are not exactly the same as prescription medications. So that can sort of open up some room for, hey, is this the right thing for patients to be doing? But that aside, again, these medications are often prescribed at doses lower than what the FDA indication is. So the question is, should you microdose? Is it good? Is it bad? Well, let's talk about the pros and the cons, okay? Now, it seems that microdosing has been proposed for a number of reasons. Oftentimes, lower doses of GLP-1s, microdosing, might be more cost effective. People might be able to afford a microdosed dose as opposed to, say, the FDA approved dose that the pharmacy is going to give. They might be able to afford that a lot easier, especially coming from some of these companies that are selling it. So cost might be a factor. Another thing is side effects. We know that GLP-1 medications can have side effects for some people. Gastrointestinal side effects with the stomach tend to be the most common. So whether it's nausea, whether it's abdominal cramping, whether it's constipation, I'd say those are the three most common I see. Nausea and constipation are probably the most common that I see in my office, in my practice. But abdominal cramping, some people do get like vomiting, they might get diarrhea. I see that less, but either way, stomach issues can be a thing. And some people actually have stomach issues to the point that they can't tolerate GLP-1s. You might know someone that has been in the situation, it might have been you. And for this patient, perhaps the microdosing may seem appealing because it's not the full FDA approved dose of GLP-1. It's a smaller dose, and it may help minimize the symptoms. So that could be a potential pro, along with being lesser of a cost, right? It could be less side effects for some people. Maybe some people don't want to lose as much weight as others, or maybe they just don't want to lose as much weight as they may be on the full dose FDA approved doses, so maybe they go for microdosing. I'm actually really curious what some of the companies that are offering these are counseling patients on. Please write in the comments and let me know, who they're offering these to as options, because I just like to know. So those could be some potential pros. Cons, okay. Potential cons could be the medications often are compounded, which means it's not sort of the gold standard medication that you're getting from the pharmacy, from the actual drug maker. Now remember, with the shortage of these medications, compounding was sort of allowed to some degree, but it still can be the wild, wild west, okay? Compounding doesn't mean it's exactly the same. Again, it's a whole other ball of wax I'm not going to go into. But there's that issue, is that it's compounded. The other thing, and I think this is the thing that's the biggest for me, the biggest con, is that we don't have studies and data saying what microdosing does for people. If it's helpful, if it's not, if it causes side effects that we wouldn't imagine, if it's good, if it's not. And I know some people might say, well, I'm sure it's fine, right? It's just less of a dose, so can't be harmful. The thing you have to understand is that in medicine, we never assume, okay? You can't assume that just because it's a lower dose means it's harmful or less harmful or perfectly fine. We don't have the data, and as a physician, our job is to do no harm. And one of the reasons why FDA-approved medications are so... Alexa, stop. Oh my gosh, does she do that for you? Like, she just pops on at random times. I'm so sorry about that. Write in the comments if Alexa ever does that to you. Gotta make sure I don't say her name too loud. But the thing about it is, one of the benefits, huge benefits of FDA-approved medications that allows us to feel so comfortable with them is that they've been studied. They've been tried and true. We've studied them. We have lots of data. That's how we know things are safe or not safe. And that's important, which is why the biggest con for me with microdosing is we don't have the data. I can't say that I know for sure that patients statistically do X, Y, or Z or A, B, C with these medications. And that really opens us up. It's the wild, wild west. I understand why people have come up with this idea. Cheaper, maybe less side effects, maybe blah, blah, blah. But there are risks. There are compounded medications. We don't have the data. The data is huge. So I'd love to know what you think. I'd love to know if you are on any, if you're microdosing GLP-1s, please tell me why you're doing it, what your experience has been like. I just want to know. But understand that there are pros and cons, and you really should always talk with your doctor first about anything you decide to do. It's really important. GLP-1s, by the way, and let me just say this before we close, GLP-1s have really changed the game. I'm such a fan of these medications, so I want to be very, very clear. I prescribe these medications in my practice to patients every single day. They are indicated for diabetes. They are also indicated for overweight and obese people with certain underlying medical conditions. These medications have literally almost single-handedly changed the game, and I support them. They're not right for everyone, but they really have helped so many people, and I am a big fan. So I want you to know that as I give these pros and cons, it's not coming from a place of not supporting these medications. No, I do each and every day, and I encourage them for the patient that they might be right for. So talk to your doctor. Let me know what you think about this video. Let me know what you're doing. Guys, I'm Dr. Jen Caudle, practicing family physician, on-air health expert, and video creator. I do daily videos on all sorts of stuff, GLP-1s, weight loss, sex, love, blood pressure, diabetes, you name it. If you have not liked and followed my page on Facebook, please do. Please subscribe to my channel here on YouTube and click the little bell for updates. I'm also on social media everywhere. So we're talking TikTok, LinkedIn, WhatsApp, like all the things. So please follow me. And something in the last few years that I had is a free health newsletter. It's a summary of a lot of my videos in case you miss anything. Also, just hot topics that you need to know about. You can sign up for it at my website. So you just want to go to www.drjencaudle.com, drjencaudle.com. Sign up for my free health newsletter. So yeah, guys, that's my take. Let me know what you think. All right.